get started in your field?
Well, I've been in the area of neurodevelopmental pediatrics since 1993, but directing this program, which I established since 1998.
And what pulled you in? I mean, there was no such thing. I mean, the diseases you talked about today were not looked at, right? They were not investigated. There was no possibility for treatment. What pulled you in?
Well, what pulled me in was that I had a clinic where I was seeing babies and youth, mainly for the purpose of teaching residents, and a patient was referred to me for a developmental evaluation, and it was a patient with Krabbe disease. And when I met the mother and the patient, and I realized what a horrible disease this was going to be, which I did from the very few publications there were, I felt like this mother was on her own, and we as physicians couldn't really contribute much because we knew probably as much as she did by that point, and very soon she knew more than we did. So that's when I realized that unless we had there was an effort to bring these patients together, we would never be able to help other families, and I just felt it was just very tough to live what they had to live, which is to see their children deteriorate and die without helping them in any way.
Why do you think so little was done? Because, as you said earlier, these are not new mutations. They've been around. These children have been born. Children have been born with these mutations for a long time. How come there was nothing there to look into these?
Well, what happens is that the incidence of this disease they're so rare that most physicians would probably see at best one of these cases in their entire life. So besides the people who describe these diseases, there are too many people who would diagnose them or follow them. So that's why I think there was such little information. But I guess once you put together an effort to actually look at this in detail and try to help these families, it was incredible how many families actually appeared. So it was actually a very rewarding experience because I have seen probably more children now with Krabbe than anybody in the world, and that makes me an expert just by being able to see them and communicate with these families. And just by trying to find ways to help them, we have learned a lot and we have improved the management. And I think the families are not feeling like they're kind of on their own